The medic holds out a small white pill and tells the prisoner to take it. The prisoner stares at the pill as if it is a trick. His name is Martin. He is 18 years old. His left hand is wrapped in dirty bandages, infected and swollen from a cut he got 3 weeks ago. The medic, Corporal James Anderson, says through an interpreter that the pill is penicillin, an antibiotic that will fight the infection. Martin looks at the pill, then at Anderson, then back at the pill. He asks a question in German that the interpreter translates. "We get medicine." Anderson nods. "Yes, you get medicine." Martin's face goes through a series of expressions. Confusion, disbelief, and then something that looks like he might cry. He takes the pill with shaking hands, swallows it, and says something else in German. The interpreter translates. Martin said he thought prisoners were left to die. "We are at Camp Breckinridge in Kentucky in July 1944, 1 month after the D-Day invasion of Normandy. The camp holds approximately 3,000 German prisoners of war, mostly captured in North Africa and Italy during 1943. The prisoners live in barracks, work on farm details and camp maintenance, and receive medical care from a small Army medical unit. The care is basic but functional, treating work injuries, managing chronic illnesses, and preventing disease outbreaks. Martin has been at Camp Breckinridge for 2 months, transferred from a processing center in Virginia. He works on a farm detail, harvesting vegetables and repairing fences. 3 weeks ago, Martin cut his left palm on a piece of rusty wire while fixing a fence. The cut was not deep, maybe an inch long, but he did not clean it properly and it got infected. At first, the infection seemed minor. The cut was red and swollen, but Martin wrapped it with a strip of cloth torn from an old shirt and continued working. He did not report the injury because he was afraid of being punished for carelessness or being taken off the work detail. Work details meant being outside, getting fresh air, and having something to do. Sitting in the barracks all day was worse, so Martin kept working and ignored the pain in his hand. But after a week, the infection was clearly getting worse. Red streaks appeared on his forearm, tracking up from the wound. The swelling spread to his entire hand. Pus leaked from the cut, soaking through the makeshift bandage. Martin developed a fever. Other prisoners in Martin's barracks noticed he was sick and told him he needed to see a medic. Martin was reluctant. In his experience, which consisted of 6 months in the German army and 3 months in various prisoner camps, medical care was non-existent or worse. You reported an injury and you got told to toughen up. You reported being sick and you got accused of malingering. Martin expected nothing different in an American camp, but the fever was getting worse and the pain in his hand was unbearable. Finally, Martin went to sick call, the daily medical clinic where prisoners could report health problems. He walked into the clinic expecting to be dismissed or punished. Instead, Anderson took one look at his hand and ordered him into the examination room immediately. We are still at Camp Breckinridge, and Anderson is examining Martin's infected hand. Anderson cuts away the dirty bandage and exposes the wound. The cut itself is small, but the tissue around it is inflamed, swollen, and oozing pus. The red streaks on Martin's forearm indicate lymphangitis, a spreading infection traveling through the lymphatic system toward the heart. If untreated, this type of infection can cause sepsis and death. Anderson takes Martin's temperature, 102.4 degrees. He checks Martin's pulse, elevated at 110 beats per minute. Martin is in the early stages of systemic infection. Anderson knows he needs to act fast. Through the interpreter, a German-American private named Carl Becker, Anderson asks Martin when the injury happened. Martin says 3 weeks ago. Anderson asks why Martin waited so long to seek treatment. Martin hesitates and then says he did not think anyone would help him. He is a prisoner. Prisoners do not get medical care. Anderson looks at Martin and says something that Becker translates carefully. In this camp, prisoners get the same medical care as American soldiers. That is the rule. Martin does not respond. He does not believe it. Anderson can see the disbelief in Martin's eyes. It is not hostility or defiance. It is the learned expectation that authority figures do not help, they only punish or ignore. Anderson cleans the wound with antiseptic solution, a process that makes Martin wince and bite his lip to keep from crying out. The infection is too deep for topical treatment alone. Martin needs systemic antibiotics to kill the bacteria spreading through his body. In 1944, That means penicillin, a new miracle drug that has been in mass production for less than 2 years. Anderson tells Becker to explain to Martin that he will receive an antibiotic injection now, and oral antibiotic pills to take for the next 7 days. The infection will clear up if Martin takes the medication as prescribed. Becker translates. Martin stares at Anderson with an expression of complete incomprehension. He says something in German. Becker translates. Martin asked if this is real or if Anderson is making fun of him. We are still in the examination room, and Anderson is preparing a penicillin injection. He fills a syringe with the antibiotic solution, a thick white liquid that must be injected intramuscularly. Anderson tells Becker to explain the process to Martin. Martin will receive 1 injection now. It will hurt. Then he will take pills twice a day for 7 days. The infection will start to improve within 24 to 48 hours. Martin listens and nods, but his face shows he does not really believe this is happening. Anderson administers the injection into Martin's upper arm. Martin flinches but does not make a sound. Anderson applies a fresh bandage to Martin's hand and gives him a small paper envelope containing 14 penicillin tablets, enough for 7 days at 2 pills per day. Anderson tells Martin through Becker that he must take 1 pill in the morning and 1 in the evening, every day, until all the pills are gone. Even if the infection looks better, Martin must finish all the medication. Stopping early will allow the bacteria to come back, possibly stronger. Martin takes the envelope and holds it like it is made of glass. He asks another question through Becker. How much does this cost? Anderson looks confused. Becker explains that Martin wants to know how much he has to pay for the medicine. Anderson says there is no cost. Medical care and medication are provided by the camp. Martin looks at the envelope again and his eyes fill with tears. He does not cry, but his voice shakes when he says something in German that Becker translates. I did not know anyone would care if we lived or died. Anderson is quiet for a moment, processing what Martin just said. Then he tells Becker to make sure Martin understands that he should return to the clinic in 3 days for a follow-up examination. If the infection is not improving, Martin needs to come back immediately. Anderson also tells Martin that if he has any other health problems, he should report them. There is no punishment for being sick or injured. That is not how this camp operates. Martin nods, still holding the envelope of pills. He thanks Anderson in broken English, one of the few English phrases he knows. Anderson nods and tells him to go rest. Martin leaves the clinic, walking slowly, looking at the pills in his hand every few steps as if he expects them to disappear. We are now in the prisoner barracks where Martin lives with 40 other German prisoners. Martin returns from the clinic holding the envelope of penicillin pills. His hand is wrapped in a clean white bandage. The other prisoners gather around and ask what happened. Martin tells them the medic examined his hand, gave him an injection, and gave him pills to take for a week. One prisoner, an older man named Hans who was captured in North Africa, asks if Martin had to pay for the medicine or work extra hours to earn it. Martin says no, the medic said it was free. The prisoners exchange glances. Several of them do not believe Martin. They think he is confused or misunderstood. Hans asks to see the pills. Martin opens the envelope and shows the white tablets. Hans examines one and confirms it looks like real penicillin, not placebo or aspirin. He asks Martin if the American medic really said the medicine was free. Martin nods. The medic said prisoners get the same medical care as American soldiers. Hans shakes his head slowly. He says he has been in 3 different prisoner camps and has never received real medical care beyond bandages and aspirin. If what Martin is saying is true, this camp is different. Another prisoner, a younger man named Friedrich, says maybe it is propaganda. Maybe the Americans are being nice now to make prisoners think they are civilized, but it will not last. Martin says he does not care if it is propaganda. His hand is infected and they gave him medicine. That is more than the German army did for him. Over the next 2 days, Martin takes the penicillin pills as instructed. The other prisoners watch him closely, curious to see if the medicine actually works. By the 2nd day, the redness in Martin's hand starts to fade. The swelling decreases. The fever breaks. By the 3rd day, the infection is visibly improving. Martin returns to the clinic for his follow-up appointment and Anderson examines the hand. The wound is healing properly. The lymphangitis streaks are gone. Martin's temperature is normal. Anderson tells Martin the infection is clearing up and he should continue taking the pills for the full 7 days. Martin thanks Anderson again, this time with more confidence. Anderson can see the change in Martin's posture. He no longer looks like he expects to be punished or dismissed. He looks like a patient who trusts his doctor. We are now a week after Martin's first visit to the clinic, and his hand is fully healed. But to understand why Martin was so shocked by receiving antibiotics, we need to go back and trace his experiences before arriving at Camp Breckenridge. Let us go back 10 months to September 1943 in Germany. Martin was 17 years old, living in a small town in Thuringia. His father was killed on the Eastern Front in 1942. His mother worked in a factory. Martin was in school when he received his draft notice. He was sent to a training camp for 6 weeks of basic training, then assigned to an infantry unit being deployed to Italy to reinforce German positions against the Allied advance. Martin's unit arrived in Italy in November 1943 and was immediately thrown into defensive positions south of Rome. The fighting was brutal. Martin spent 3 months in trenches and foxholes, under constant artillery fire and air attack. Medical care was minimal. The unit had 1 medic for 200 men. The medic had bandages, morphine, and sulfa powder, but no antibiotics and no proper surgical equipment. Wounded men were patched up and told to keep fighting. Martin saw men with infected wounds who were not evacuated to field hospitals because there were not enough ambulances and the roads were under constant attack. Some of those men died from infections that could have been treated. Martin learned quickly that the German military did not have the resources or the will to care for wounded soldiers properly. In February 1944, Martin's unit was surrounded by American forces during the Battle of Anzio. After 3 days without food or ammunition, the unit surrendered. Martin was marched to a temporary holding camp, a muddy field surrounded by barbed wire with no shelter and minimal food. There was a single American medic serving over 500 prisoners. The medic treated only the most critical cases: men bleeding out, men with compound fractures, men in shock. Minor injuries and illnesses were ignored. Martin spent 2 weeks in that camp, watching men suffer from untreated wounds and dysentery. The lesson was reinforced. If you are sick or injured, no one will help you. You either survive on your own or you die. We are still tracing Martin's journey before Camp Breckenridge, and now we follow him through the prisoner transport system. From the holding camp in Italy, Martin was moved to a larger transit camp where conditions improved slightly. There were tents, latrines, and regular meals, but medical care was still limited. Martin saw a prisoner with a badly infected leg wound who was refused treatment because the wound was not life-threatening. The man's leg eventually had to be amputated. Martin filed that away as more evidence that medical care was not for prisoners. In April 1944, Martin was loaded onto a ship bound for the United States. The voyage took 18 days. The ship's medical officer treated acute emergencies but nothing else. Martin stayed healthy during the crossing, but he saw others suffer from seasickness, dehydration, and untreated chronic conditions. When the ship docked in New York, Martin went through intake processing. The medical screening consisted of a temperature check and a visual inspection. No one asked if he was injured or sick. Martin was sent by train to a processing center in Virginia, where he spent 3 weeks before being transferred to Camp Breckenridge. During those 3 weeks, Martin cut his hand on the rusty wire and made the decision not to report it. He expected that if he reported the injury, he would be accused of trying to get out of work. Or worse, he would be punished for damaging government property, the wire fence. So he wrapped the cut with a strip of cloth and said nothing. The infection set in and worsened over the next 2 weeks. Only when the fever became unbearable did Martin finally go to sick call. Let us know in the comments where you are watching this from. Are you in the United States, Germany, the United Kingdom, or somewhere else? We would love to know who is keeping these stories alive. All of Martin's previous experiences taught him that authority figures do not help. They ignore, punish, or blame. Anderson's response, examining the hand, cleaning the wound, giving an injection, and providing antibiotics, was so far outside Martin's expectations that Martin thought it was a trick or a joke. The idea that prisoners would receive the same medical care as American soldiers was incomprehensible to Martin based on everything he had experienced in the German military and in the transit camps. The penicillin pills were not just medicine. They were proof that his assumptions about the world were wrong. We returned to Camp Breckenridge 2 weeks after Martin's hand healed, and the story of his experience has spread through the prisoner population. Other prisoners who have been hesitant to report injuries or illnesses start going to sick call. A man with chronic stomach pain that he has suffered for months finally sees a doctor and is diagnosed with an ulcer and given medication. A man with an abscessed tooth that he has been ignoring finally gets dental treatment and has the tooth extracted. A man with persistent cough and chest pain is diagnosed with early-stage pneumonia and treated with antibiotics. Each of these prisoners goes through the same reaction Martin did: disbelief, confusion, and then gratitude. If you are enjoying this story and want more untold accounts from World War II prisoners of war, make sure to subscribe to the channel. We are bringing you stories that most history books never covered. Anderson and the other medical staff at Camp Breckenridge noticed the increase in sick call attendance. Anderson talks to Becker, the interpreter, and asks what changed. Becker explains that the prisoners did not trust that they would receive real medical care. Martin's story about getting penicillin for his infected hand spread through the camp and changed perceptions. Now prisoners believe they will actually be treated if they report health problems. Anderson is surprised and troubled by this. He asks Becker if the prisoners really expected to be denied medical care. Becker says yes, based on their experiences in the German military and in transit camps. That is exactly what they expected. Anderson writes a report to the camp medical officer describing this phenomenon. The report notes that many prisoners are suffering from untreated conditions because they do not trust they will receive care. Anderson recommends more outreach, more education, and more visible examples of prisoners receiving treatment. The medical officer approves the recommendations and implements new policies. Prisoners are given informational pamphlets in German explaining their rights to medical care under the Geneva Conventions. The camp runs educational sessions where German-speaking staff explain the medical services available. Slowly, the culture shifts. Prisoners start to understand that this camp is different from what they experienced before. We are now 3 months after Martin's initial visit to the clinic, and we need to understand the larger context of why American prisoner of war camps provided medical care to German prisoners. The Geneva Conventions of 1929 established rules for the treatment of prisoners of war, including requirements for adequate food, shelter, and medical care. The United States was a signatory to the conventions and took them seriously, partly out of genuine humanitarian concern and partly out of strategic calculation. If the United States treated German prisoners well, Germany was more likely to treat American prisoners well. This reciprocity was not always effective, especially regarding American prisoners held by Japan, but it influenced policy toward German and Italian prisoners. The provision of medical care to prisoners was not just legally required. It was also practically necessary. Disease outbreaks in prisoner of war camps could spread to surrounding civilian populations and to American military personnel working at the camps. Treating prisoners' illnesses and injuries prevented epidemics and maintained camp security and order. Healthy prisoners were also more productive workers on farm details and camp maintenance, which supported the American war economy. These practical considerations aligned with legal obligations to create a system where prisoners generally received adequate medical care, though the quality varied by camp. The availability of penicillin in 1944 was a recent development. Penicillin was first mass-produced in 1943 and was prioritized for military use to treat wounded soldiers. The decision to make penicillin available for prisoner of war camps was controversial. Some argued that scarce medical resources should be reserved for American troops. Others argued that withholding effective treatment from prisoners violated the Geneva Conventions and undermined American moral authority. The decision was made at high levels to provide penicillin and other advanced medications to prisoner of war camps, though supplies were often limited and prioritized for the most serious cases. Martin received penicillin because his infection was spreading and posed a risk of sepsis and death. Anderson made the medical determination that penicillin was necessary, and the camp had supplies available. Let us pause Martin's personal story and look at the scale of medical care provided to prisoners of war in the United States during World War II. The United States held approximately 400,000 German and Italian prisoners at the peak of the system in 1945. These prisoners were housed in over 500 camps across the country. Each camp had a medical facility, ranging from small clinics with 1 or 2 medics to full hospitals with multiple doctors and surgical capabilities. Medical records from the period show that prisoner of war camps treated hundreds of thousands of cases, work injuries, chronic illnesses, infectious diseases, and surgical emergencies. The most common medical issues treated in the camps were work-related injuries such as cuts, sprains, and fractures. These accounted for about 40% of medical cases. Infectious diseases such as pneumonia, influenza, and gastrointestinal infections accounted for another 30%. Chronic conditions like dental problems, ulcers, and vision issues accounted for 20%. The remaining 10% were surgical cases, mental health issues, and rare diseases. The mortality rate among prisoners in American camps was very low, less than 1%, which is remarkable given the large population and the wartime conditions. This low mortality was directly attributable to adequate food, sanitation, and medical care. The distribution of antibiotics to prisoner of war camps in 1944 and 1945 is documented in Army medical supply records. Penicillin, sulfa drugs, and other antibiotics were allocated to camps based on prisoner population and medical needs. Camps with higher rates of infectious diseases received more supplies. The distribution was not perfect, and some camps experienced shortages, but overall the system functioned well enough that most prisoners who needed antibiotics received them. Martin's case was typical in that sense. He had a life-threatening infection. Anderson prescribed penicillin, and the camp pharmacy had supplies available. What was atypical was Martin's reaction of shock and disbelief, though as Anderson discovered, that reaction was rooted in real experiences that many prisoners shared. We are now in May 1945, and the war in Europe is over. Germany has surrendered unconditionally. Martin is still at Camp Breckenridge, working on farm details and helping with medical outreach. The news of Germany's surrender is met with mixed emotions among the prisoners. Relief that the killing has stopped, grief that Germany has lost, anxiety about what comes next. Martin has received 2 letters from his family through the Red Cross. His mother is alive. Their town was captured by American forces with minimal fighting. The house is damaged but habitable. Martin's younger brother survived the war. Martin reads these letters multiple times, grateful that his family made it through. The camp atmosphere changes after the war ends. Work details continue, but there is less urgency. Prisoners start educational classes, learn trades, and prepare for repatriation. Martin continues his volunteer work with the medical staff. Anderson writes a commendation letter for Martin, noting his contributions to improving prisoner health and trust in medical care. The letter goes into Martin's file and will follow him through the repatriation process. Martin does not know what practical use the letter will have, but Anderson believes it is important to document Martin's positive role in the camp. We are now in early 1946, and Martin is approved for repatriation. He will be part of a group of 600 prisoners returning to Germany in March. Martin packs his belongings: a few clothes, some books, the commendation letter from Anderson, and a small bottle of aspirin that Anderson gave him as a parting gift. Anderson also gives Martin a handwritten note in German explaining Martin's medical history, including the infected hand and the penicillin treatment. The note is for any future doctors Martin might see. Anderson tells Martin through Becker that if he has any health problems in Germany, he should show this note to a doctor. Martin thanks Anderson and says he will never forget what Anderson did for him. Anderson says he was just doing his job, but Martin shakes his head. It was more than that. The voyage back to Europe takes 2 weeks. Martin spends the time thinking about the future. Germany is destroyed. His town is damaged. Opportunities will be scarce. But Martin has learned skills at Camp Breckenridge: farming, carpentry, and basic medical knowledge from helping with outreach. He thinks he might find work related to health care or community rebuilding. When the ship docks in Bremen, Martin goes through repatriation processing. He is questioned, given identity papers, and cleared for release. He boards a train to his hometown. The journey takes 3 days. When Martin arrives, he finds his mother and brother living in the damaged house, trying to rebuild. The reunion is emotional. Martin is home. Martin spends the next several years helping rebuild his town. He finds work as a medical orderly at the local hospital, assisting doctors and nurses with basic patient care. The hospital is understaffed and struggling with limited supplies, but Martin's experience at Camp Breckenridge helps him navigate the chaos. He knows how to change bandages, take vital signs, and communicate with patients about medication. The doctors at the hospital appreciate Martin's competence and willingness to learn. In 1948, Martin enrolls in a training program to become a certified nursing assistant. He completes the program in 1950 and works as a nurse for the next 30 years. In 1951, Martin marries a nurse he met at the hospital. They have 3 children over the next decade. Martin builds a stable, fulfilling career in healthcare. He tells his children about his time as a prisoner of war, and he always mentions the American medic who gave him penicillin for his infected hand. Martin says that moment changed his understanding of what medical care should be: accessible, effective, and compassionate. He tries to provide that same standard of care to his patients throughout his career. Martin retires in 1980 and dies in 2002 at the age of 76. His children remember him as a dedicated nurse and a kind man who believed medicine was about helping people, no matter who they were. We shift focus briefly to Corporal James Anderson and what happened after the war. Anderson worked at Camp Breckenridge until the camp closed in late 1946. He treated thousands of prisoners during his time there, and Martin's case was one of many. But Anderson remembered Martin because of the shock and disbelief when Anderson handed him the penicillin pills. That reaction made Anderson realize how low prisoners' expectations were and how much impact simple, competent medical care could have. After the war, Anderson returned to civilian life and worked as a physician assistant in rural Kentucky. He often thought about the prisoners he treated and wondered what became of them. In 1970, Anderson was interviewed for an oral history project about World War II medical services. During the interview, Anderson talked about his time at Camp Breckenridge and mentioned Martin's case without using Martin's name. Anderson said the look on the young prisoner's face when he received antibiotics was something he never forgot. It was not just gratitude. It was the realization that someone cared whether he lived or died. Anderson said that moment taught him an important lesson about the power of basic human decency in medical care. Patients need to know they matter. That knowledge alone can be healing. What does Martin's story tell us about World War II and the treatment of prisoners of war? On one level, it is a story about the gap between policy and perception. The Geneva Conventions required medical care for prisoners, and the United States generally provided it. But many prisoners did not believe they would receive care because their previous experiences taught them otherwise. Martin's shock at receiving penicillin was not irrational. It was based on real experiences in the German military and in transit camps where medical care was minimal or non-existent. Rebuilding trust required not just providing care, but demonstrating it repeatedly until prisoners believed it was real. On another level, Martin's story is about the transformative power of simple acts of competence and compassion. Anderson did nothing extraordinary. He examined an infected wound, prescribed the appropriate medication, and explained the treatment clearly. This is basic medical practice. But for Martin, it was revolutionary because no one had ever done that for him before. The penicillin healed Martin's hand, but the experience healed something deeper, his belief that he was disposable. Martin learned that even as a prisoner, even as an enemy soldier, he had value as a human being. That lesson shaped the rest of his life. The shock that everyone witnessed when Martin received antibiotics was not just about the medicine. It was about the collision between expectation and reality. Martin expected to be ignored or punished. Instead, he was helped. That cognitive dissonance was visible on his face when he held the envelope of pills and asked if it was real. The shock was Martin's worldview breaking and reforming in real time. The old worldview, learned through months of neglect and suffering, said authority figures do not care.